It started late in the evening. Nothing dramatic. Nothing that made anyone panic. She was sitting in her chair, staring at the TV, but not really watching it. When her daughter asked a simple question, she didn't answer. When asked again, she looked confused, irritated, almost scared. Her daughter whispered what so many caregivers say, maybe this is just the dementia getting worse. But here's the truth most families don't know. Dementia does not happen suddenly. Delirium does. As a retired nurse, I've seen this mistake too many times. And I want you to hear this clearly, because it can save a life. Her confusion came on within hours. Earlier that day, she had been talking, eating, and moving around as usual. Now she couldn't follow a conversation. She didn't know where she was. She tried to stand, then sat back down as if the room was spinning. Her daughter hesitated. She didn't want to overreact. She didn't want to bother anyone at night. So they waited. By morning, things were worse. She was trying to get out of bed repeatedly. Her words didn't make sense. She became restless, then suddenly very quiet. That's when they finally called for help. At the hospital, the word dementia was mentioned again, until the tests came back. This wasn't dementia. This was delirium. Delirium is an acute medical emergency, especially in older adults. It comes on fast, sometimes in hours or days. And it is usually triggered by something serious happening inside the body. An infection, low oxygen, dehydration, low blood sugar, a reaction to medication. In her case, it was a urinary tract infection combined with dehydration. There was no fever, no pain, just confusion. And that is exactly why delirium is so dangerous. Here's what caregivers need to know. Dementia is gradual. It develops slowly over months and years. Delirium is sudden. A sharp change in thinking, behavior, or awareness. If someone is not themselves all of a sudden, that is not normal aging. That is not just dementia. That is your signal to act. As a nurse, this is the red flag I want burned into your memory. Sudden confusion is an emergency until proven otherwise. Delirium increases the risk of falls, aspiration, rapid physical decline, and even death if untreated. The longer it goes unrecognized, the harder it is to reverse. So what should you look for at home? Watch for sudden changes like confusion that appeared quickly, new agitation or restlessness, hallucinations or paranoia, sudden drowsiness or withdrawal, not recognizing familiar people, trouble focusing or following simple directions. If these changes happen over hours or days, do not wait. This is where care before crisis truly matters. Early action can mean treatment instead of ICU, recovery instead of decline, home instead of long-term care, and most importantly, more time with the people you love. If you are caring for an older adult, please hear this: trust your instincts. If something feels off, it probably is. You are not overreacting. You are being careful. You are being wise. This video is for education only and does not replace medical advice. If you notice sudden confusion or changes in behavior, seek medical care immediately. And if this message helped you, even a little, subscribe for more stories and education focused on care before crisis.